Hello and welcome to the Digital Eye Clinic. I am Sankha Udakumbura, a cataract and eye health specialist here in Cardiff. Today we are talking about one of the most common eye conditions in the world, cataracts. We are going to discuss what they are, why they happen, the symptoms to look out for, and when you might need treatment. Let's dive in. A cataract simply means the natural lens inside your eye becomes cloudy. This lens normally acts like a crystal clear window, helping light travel into your eye so you can see sharply. But as we get older, the proteins inside the lens change and it gradually becomes misty, a bit like a frosted bathroom window. A cataract is not a film that grows over the eye. It's inside the eye, behind the colored part of your eye, which is called iris. There are many causes, but the number of one reason is simply aging. Most people will develop some degree of cataract after the age of 60. It's completely normal. Other common causes include genetics, especially if your parents had cataracts at young age, diabetes, which speed up cataract formation, long-term steroid medication, often for conditions like asthma and arthritis, significant sunlight or UV exposure, and previous eye surgery or trauma. And sometimes cataract can occur earlier, in 40s or 30s, especially if there's a strong family history or medical condition. There are more than one type of cataract. Each affects vision slightly differently. There are three main types: nuclear, cortical, and posterior subcapsular. Nuclear cataracts form in the center of the lens. It causes gradual blurring and yellowing of vision. Cortical cataracts forms like a zigzag or spoke-like pattern around the edges of the lens. They cause glare and difficulty with night driving. Posterior subcapsular cataracts forms near the back of the lens, causing glare, halos, difficulty in reading, and bright light. These cataracts progress faster than the other types. You don't need to remember these names, but they help to explain why cataracts behave differently in different people. Many people don't realize they have a cataract until it starts affecting daily life. Here are the most common symptoms: blurred or cloudy vision, glare or halos around the lights, difficulty with night driving, colors appearing faded or yellow, needing more light to read, frequent changes in glass prescription. One important thing to know is cataracts doesn't cause pain, redness, or sudden loss of vision. They progress slowly and gently. In the early stages, cataracts can often be managed with new glasses, brighter lighting, or anti-glare lenses. But glasses won't make the cataracts go away. As the clouding worsens, glasses become less helpful, and that's when surgery becomes the best option. This is one of the questions I'm asked most often. You should consider surgery when the cataracts start affecting your quality of life. This could be reading, driving, recognizing faces, your job, or your hobbies. You may benefit from surgery if you have stopped driving at night due to glare, you're struggling with reading or watching television, or tripping or feeling less confident outdoors, or optician says your cataract is advanced. There is no perfect time for cataract surgery. It depends entirely on how cataracts are affecting you. But delaying too long can make the surgery slightly more complex. The good news is that cataract surgery is one of the safest and most successful operations in the world. More than 400,000 surgeries are performed every year in the UK alone. The cloudy lens is gently removed and replaced with a clear artificial lens called an intraocular lens. Most people notice a big improvement within days. If you think you might have a cataract or you have been told you have one, don't worry. It's an extremely common condition and treatments are highly effective. You don't need to rush into surgery, but you also don't need to struggle with poor vision. Thank you for watching today's video. If you found this helpful, please give it a like and subscribe to the Digital Eye Clinic for more simple, trustworthy eye health information. I am Dr. Sankha Udakumbura, cataract and eye health specialist here in Cardiff. See you in the next video.